Hey there, everybody. It's time for another thoughts of a predicate thinker, or another living with segment. Basically, this time I'm going to be going over something else that plagues quite a lot of people, but my personal experience with it. And this is another disorder of sorts. It is anxiety. Maybe anxiety disorders, but anxiety in general. Um, First of all, if you can't spell it, it's ANXIETY. Anxiety. Straight from WebMD, these are some of the symptoms. So we could be a little scientific here. Feelings of panic, fear, and uneasiness. Problems sleeping. Cold or sweaty hands and or feet. Shortness of breath. Heart palpitations. An inability to be still and calm. Dry mouth. Numbness or tingling in the hands or feet. Nausea. Muscle tension. Dizziness. Alright, so those are just some basic examples of the symptoms that it causes. And I could speak from my own experience that I do happen to have anxiety from time to time. And it does cause those things. The panic, fear, and uneasiness, definitely. Problem sleeping, for as long as I can remember. Cold or sweaty hands and or feet, sometimes. Shortness of breath, yes, definitely. That's one that I really dislike. Heart palpitations, yes, I do like those either. They're very worrying. An inability to be still and calm. I can't even be calm and still right now, so I mean that's obvious. Dry mouth, yeah, sometimes. Numbness or tingling in the hands or feet, not really often. Nausea, yeah, sometimes. I hate that as well. It's an uneasy feeling. Muscle tension, perhaps a little bit. Dizziness, not often, but yes. So all these symptoms I've had at some point or the other, and together as well. But they can be caused from other things as well. But anyways, we get back to anxiety in general. And speaking in general, one disorder is pretty much a basic one. It's generalized anxiety disorder, which is just general worrying and uneasiness to like an excessive amount. It's pretty much what I would describe myself as. I worry a whole lot about things that really most people just tell me that it's stupid, but they don't seem to understand for some reason that it is not something I do by choice. I try as hard as I can to prevent it or fight it. That's the only thing I can do. I mean, pretty sure something like an anxiety disorder is something that you're born with. It's not something that just happens. It's not some illness you just catch. I mean, it's not like you fell and I got an anxiety disorder now. Damn. Pretty much has to do more so with how your brain is wired, I guess, which is from birth. There's social anxiety disorder, which is basically just like generalized, except it's specifically to social interactions. That one as well definitely applies to me because I worry about social interactions a lot more than anyone I know. I get nervous, even go as far as say scared, very worried when it comes to other people, for myself and for them. Like for example, pretty much anyone that actually really knows me knows that if I message them, text them, call them, or try to get in contact with them some way, and after a reasonable amount of time they don't respond, I will be pretty upset. And depending on the situation, I'd pretty much be worried about their own safety. Well, of course, depending on what had happened before then. Or maybe I'd be upset and think I did something wrong. Or maybe they're doing something wrong and they don't want to tell me. And then that just causes more anxiety, and I worry and I stress more, and then I'm just like, I don't know what to do. Like, I need to contact them. I'm worried about them. I don't know. Maybe they're trying to contact me. Something happened, And these are things you just gotta deal with every day, basically. And that. But the other part of social anxiety is go being out in something like any kind of get together, party, social event, group gatherings, meetings, conferences, anything like that. Or for example, public speaking, having to get up on a stage right, and speak. It is a very anxiety causing thing. It causes a lot of unnecessary stress, worry, fear, maybe of getting embarrassed or laughed at or criticized, chastised, scrutinized, whatever other word you want to use. But you worry about, oh, what if this person doesn't like it? Maybe they're boomy. I mean, I'm not gonna lie. One of my problems is that I do not want to get up on a stage in front of people, and it's something I've been trying to just trying to avoid, which I've done pretty well. But considering what I want to do with my life, being up in front of a stage, um, talking in front of people, public speaking, everything like that is pretty heavily involved. Because anyone that knows me, I like imparting knowledge on the people, speaking to them, helping them out, you know, being a mentor to them, a teacher of sorts, whatever you want to call it, an entertainer, a joker. I like to make people laugh, but I can't do these things when I'm just constantly anxious all the time and nervous and worried and panicking. I mean, it's really, it sucks. I mean, there's no way to say it. It freaking blows. But it's a part of life. It's not just something I have or just a few people have or something that's rare, really, I wouldn't say. Even though I might not know anyone personally that also suffers from the same things, I know there's people out there that are just as panicky, nervous, afraid, anxious, either socially or generalized. Or, another kind of anxiety would be phobias. You know, fear, like claustrophobic. Fear of being in like tight enclosed spaces, like for example, like a small closet or something like that. Or fear of heights. Fear of falling, or I don't know I forgot the term for each fear, but you know, homophobia. Like the fear of homosexuals, even though people try to just use it as a hatred of homosexuals. A phobia is a fear. It's not a hatred. Those are two different things, even though they might have some similar characteristics between them. Please try to keep that in mind, because I hate when people use words incorrectly. It's just part of me. It's whatever. But yeah, anxiety is not something to be joked around with or messed with. It really isn't. I hate when people try to talk about it like it's no big deal and you can just get over it, because you cannot. It is not something that you simply just get over. On the other hand, people try to also take every drug in the world for it. Um, I'm personally not a person that really promotes drug use, especially when it comes to abusing it. Like I don't know. There's a lot of medications for it. I believe Prozac, I think, is for anxiety, some sort of anxiety. I'm really at a loss for like the names of the medications right now. But I think Xanax too. I'm not sure. Don't quote me on that. Look it up yourself. Don't take my word for it. But yeah, considering the damage that drugs can do to your liver and other body um organs, I don't recommend it. I'm not gonna lie. I've seen a psychologist myself, of course, because I wanted to talk about my my anxiety and everything, to have someone to express it with openly, among other things, of course. And they told me It was a psychologist. Psychologists, first of all, cannot prescribe medication. That's what psychiatrists do. They're two different doctors, but they basically go over the same kind of topics. I chose a psychologist because, as I said before, I do not like taking medication. But it's sad how people try to force drugs onto every little problem that happens, especially when it's something that could be tried to help with behavioral therapy and talk therapy and whatnot. Just talk someone through it and try to get them to see from a different perspective. Really, a one-on-one conversation with someone that understands can be very helpful indeed. Trust me on that. But she wasn't a psychiatrist, and she still tried to recommend that I take this random medication, which, of course, I am not for. Personally, maybe some people probably will help them. That's fine. To each his own. I just know I'm not gonna take any because I'd rather just do the only other option, which is to just deal with what I've been given since birth. Yes, I might be afraid of this and that, and I might be very worried and upset and anxious, nervous for everyone, but it is what it is. One day, maybe I can actually hope to wake up and have a day where I don't have any type of panic attacks. Like, I don't feel like my heart's about to jump out of my chest. Someone does not answer my call and I won't get worried. One day, I hope all these things go away or I can deal with them better because it's not an easy task at all. But that's just a hope. That's all there is. You just hope. If you also suffer with anxiety or you know anyone that does have these problems, try to talk to them about it. Try to relate. Try to understand. Or if you can't, try to just listen. There's not really, you don't have to be there to give advice. I think sometimes it's really stubborn trying to give your advice on everything. I hate when people do that. If you don't understand, just listen and try your best. And if I can't do that, you can't do that, then try to introduce them to someone or show them some book, article, or something. Recommend them to some other source of information or help. Don't push them away. Don't mock them. Don't try to discredit their disorder, illness that they're suffering from. Because the keyword of that is they're suffering. And they don't need that from you also. They need a friend. They need family. They need someone there in the corner. And that's coming from me because I can relate. And maybe you can too.